Some important news tonight for the hundreds of thousands of Americans who every year undergo bypass surgery or have a cardiac stent put in.
Major new study compares the two techniques, answering the question, is one better than the other? Here's CBS 2's Dr. Max Gomez. Doc.
That's right, Maurice and Christine. That very question, stents versus bypass, was studied years ago, and surgery came out on top when it came to a mortality benefit. Bypass patients live longer, but that was done with stents that are now out of date. State-of-the-art stents yield much different results.
My heart was pumping at about 50%. One part of it wasn't really functioning at all.
Diamond had a major blockage in a heart artery and was faced with a choice: have coronary artery bypass surgery or opt for a stent, a minimally invasive procedure that's often done as a same-day procedure. The trade-off, aside from the obvious pain and rehabilitation involved with surgery, is which procedure decreased mortality the most.
And we found that there is no mortality advantage of bypass surgery when you compare it to the latest generation stents.
Dr. Bangalore is the lead author of a major study just published in the New England Journal of Medicine that provided that answer. It looked at 18,000 New York State patients, half of whom had bypass and the other half stents. In addition to equal outcomes and mortality benefit, stenting had a short-term advantage.
The bypass surgery was associated with higher risk of death and stroke when compared to stenting
In the first 30 days. The key difference between this and previous comparative studies is that the latest generation stents release a drug that prevents inflammation and scar tissue in the heart arteries. That would lead to more clots, blockages, and deaths in older style stents. For Mark Diamond, the choice was clear. He had a stent placed about a month ago and is amazed at how much better he feels.
My energy level, my mental acuity, intellectual acuity, and my mood.
All better.
All better.
Now, there are still some patients for whom surgery is the better option. For example, there was an increased risk of having a repeat procedure with stents as opposed to bypass. The bottom line, though, is a heart patient can now make a decision based on good, solid information. Christine?
Dr. Max, thank you.